If you're someone that's pushed up your squatting intensity or your training volume over a period of a training block, it's probably not unlikely that you've had elbow pain. Now, anyone that's dealt with it understands how debilitating it can be. And it's one of those things that we kind of don't really have a good operating system for it. And people are often blaming muscle groups that aren't really the cause because it's often a bit bigger than just your elbow. It's the shoulder, it's the position, it's how you hold the bar on your back. But I wanted to run through today a guide that will actually help you to get your elbows into a position when they're not as painful. Hopefully reduce or remove your pain completely. And a lot of it comes back actually to the shoulder blades, the rib cage, and how all of that is positioned. So I'm going to show you some very, very simple requirements that you need in order to actually get into a squat position to start. Because I think whenever we have a problem like this, we just need to reverse engineer it. We need to go, well, what position are we trying to get into? And how do we work back from that position? Often the lats get all the blame for shoulder pain when squatting, saying that they're too short and you can't actually externally rotate. Rotator cuff drills may be given or a little bit of lat range of movement. Now, here's just something to think about. The lats only respond to one, tension that's placed on them, but two, more so, which is the most important, the position of the bones. So if I'm flexed over like this and tight, my lats are gonna respond to that position over time and become short. So we need to figure out the step ahead of that, which is actually the root cause of why you get elbow pain. Now, something that's often not spoken about is your ability to pull your arms back past your midline. Now, I know that sounds like simple in theory, but that position there, it's not just about external rotation. It's how far you can get the bar onto your back. Logically thinking about that, if you can't get your arms back past your midline, you're going to be in an uphill battle to actually get into a comfortable position. And anything that you do, you're forcing, literally forcing that there. Now, something else to think about before we get into it is that the stability point of the barbell is on your back. It's the only point that the bar has connection with. So it needs to be super stable. You don't want to be fighting yourself to get into these positions because over time, you're just going to overload structures. So we need to figure out a better strategy that's not just blaming the lats because that is one portion of this. So we're going to break out a very simple way to look at it. Now I'm going to show you in real time actually the changes that some simple positioning drills can do. Now, just to show you, that is my range of movement, getting my arms back behind my body. This shoulder, I've had a reconstruction on. So if we come down into this stacked up position here, it looks a bit funny, but basically I'm gonna push away from the hand that's on the ground. I'm gonna try and get it as close to my midline as possible. And I'm gonna shift my entire weight over to the side away from my hand. Now from here, what I'm gonna do is think about getting tall and I'm gonna draw in a 5 to 8 second breath. Thinking about expanding through my ribs and my upper back. And then on my exhale, continue to push that way. And then draw in again. I'm gonna do one more breath here. And each time, you can see that I'm pushing away from that. Now, I'm gonna do this side. So same deal, breathe in. And then pushing across, shifting my whole midline, and then breathe in again. And exhale. And I'll do one more breath here. Now, in real time, let's see what it's done for my range. Now, if you're looking at the video, I think we could probably see there's a bit of a difference there between before and after. It feels like it's another 10 degrees further back, just on passive tension. Now, the reason for this is often our ability to get our arms back behind our body is purely muscle tension, but it's a mismatch between what our ribs and our scaps are doing. So we get these flared rib positions, and then our scapulas adapts to it by rolling forward. So what we need to do is these breathing style drills which reset it. And we get some length through the front of the chest We get some length through the lat by default, and then it allows the scaps to sit back down into a better position, and they get more flush on the actual rib cage itself, which then, without actually even doing any stretching, allows me to access more range of movement. Now, the next big point to consider is actually the elbow itself, because that's the point of pain. So start upper body and then move down to the elbow. Now, something with strength training in general and building muscle mass, we often train things in an overhand grip, which is a pronated grip. So often if you look at people when they twist their arms up to the roof, there's very limited ability to actually twist their palm to the roof. Now, that in itself shortens tissues on one side, it lengthens tissues on the other, and by default just creates impingements at the joints itself and creates pain over time and potentially weakness. Now, the next two drills I'm going to show you aren't identifying the actual supination deficit, or they're not identifying any of the muscles, say, on the extensors of the arm to strengthen up if you have got a long-standing issue. What this is just about creating a little bit of space actually at the elbow itself, which often is so relieving. So if we get a band, and what we want to do is let the band pull the elbow forward, and you can see here that there is actually getting a really big stretch of my elbow here. All the front down my actual flexors itself, and what I'm doing is I'm turning my palm up to the roof, so I'm in a supinated position. So I like to bend my elbow, straighten it out a little bit, and just let that band traction me forward, create some tension at the front of my arm here that actually gets a really nice stretch on the flexors itself and actually at the joint itself. And I almost think of twisting the arm out like that, screwing it out, because that's starting to force that supinated position that we want. It's actually really, really relieving when you do it. It feels very, very nice. Now, the next big thing that we want to do from here, I'll just use the bench whilst it's here, is you can create a little bit of joint space just by using this band to traction you that way. Sometimes as well, the pain that we get in the elbow just feels so nervy. It feels terrible. It's really debilitating. Like you walk around, it feels like your arms are shaking, you can't use them. So having a drill like that, which simply creates a little bit of traction, just gives that elbow a little bit of joint space, which sometimes is all it needs to decrease the actual symptoms in themselves. Thoracic rotation drills are great because they open up the tissue on the front, but then they also get the scap to work with the rib cage. Now, the next thing to really consider with squatting is we need the scap, the rib cage, and the back position really extended so that the bar can sit on our back. We don't want any mismatch in tension. We don't want that bar moving around at all when it's on your back. So you need to make sure that the scaps and the rib cage are actually working together. So you could obviously do extension-based drills. There's a ton of different drills you can do, but I really like rotation-based drills because we're essentially prepping the arm to get behind the midline, which is very similar to what we're doing with a squatting position. Now, you can work both ways, reach away, you can get some range this way. And what I would do is just, when you get to the bottom here at these end ranges, breathe in, breathe out, push one way, push the other way, try and keep the hips as square as you can. And then on this side, get to the end range, it's already starting to get tight. Inhale, exhale, and you'll get a little bit more range out of it. Now you can add bands to it if you have fantastic mobility, but the reality is for most people, that is gonna be enough, and it's all they need to actually get some good rotation in. Now, to wrap things up with this, we're not looking for perfect. What we're looking for is the ability to actually get the arm behind the body. We're trying to get it in a way that the elbow doesn't become the messenger in the middle. Often it's just trapped and it's just getting loaded up because we haven't got the shoulder, the ribs, and the shoulder blade in a good enough position that's strong and stable to withstand squats. It's almost normalized in the powerlifting world and the strength training world. It's like normalized to have pain, but there is nothing normal about pain, and it is such a limiter in your long-term progress purely because when you're doing movements, it hurts, it puts you off, and you're consciously or subconsciously always thinking about it. There is nothing worse. I've personally done preps before where I've been debilitated after squatting, where I couldn't actually, like post-shoulder surgery, I couldn't actually pick anything up properly for say 20 or 30 minutes after squatting. It was that bad. And you know, the thing is, that's actually not uncommon. That is something that happens in the strength world a lot. So I've explored a lot of different options with this, and I think the reality is for most people, what we need to do is get them in better positions through the ribs and the pelvis first with the breathing resets. Then we need to start to expose them to positions that are similar to what they're going to have when they have a bar in the back, which is actually getting the arm behind the body. Often, we talk about external rotation strength through the rotator cuff or getting some length through the lat, but that's all just byproducts of bad positioning or positioning that's not optimal for the squat itself. So start here with the breathing drills, incorporate them in, and then start to get more specific with the positions that you need to be in. And over time, it's going to increase your range of movement and decrease your pain, specifically at the elbow.